Hello class and welcome to week 4 of Abnormal Psychology. As always, this lecture video will discuss your week 4 activities and we'll touch on a few areas of chapters 7 and 8. But before we jump in, I do want to discuss, I do look forward to reading your papers this week. From what I have seen so far, you guys have done a great job and so much more improvement from the week before. I'm not saying that you guys didn't do a good job, but I see the growth in your writing, and I really enjoy hearing your perspectives. So I look forward to grading that, and I should have all your grades for your papers no later than Thursday. I'm going to shoot for Tuesday or Wednesday because I like to have a quick turnaround for your grades in case you have questions, comments, concerns, and things like that. But like I said, if it's not on Tuesday or Wednesday, I'll be looking forward to that grade on Thursday. So for this week, you'll have quite a few things to do. You won't have any key assignments, but you do have to read, of course, chapters 7 and 8 in your textbook. You will have a practice vignette on personality disorders, and this assignment isn't a graded assignment. However, it gives you quite a bit of reflection for upcoming assignments and things like that. This assignment will go through, of course, a scenario, and you'll have to discover and discuss specific things and how you would identify personality disorders in comparison to the person's symptoms and things like that. So I definitely think it's a great prepare for you being able to identify specific disorders. You'll also have a video to watch on borderline personality disorder. This is also an interesting video. I really want you guys to check this out. As well as you'll have your discussion board. And please remember, whenever you're doing your discussion boards, I do notice that some of you guys aren't completing the 250 words. So just be mindful of that whenever you are completing your discussion board, that you are meeting the minimum requirements and thoroughly discussing each topic so you can get that full credit for that. And you'll have, of course, your exam. And your exam will cover chapters 5 through 8. So last week's lecture and this week's lecture. For this week, I'm not going to spend that much time on the material. But I do want to give you guys a heads up that this exam is this week. So you have a bit of a time to review your PowerPoint slides and things like that, or any material that you didn't quite grasp whenever you read it last week. So let's jump right into the area of discussion. So with chapter 7, and I should have prepped this before, but of course I did not. So let's see. So with chapter 7, your discussion of topic, of course, will be somatic symptoms and dissociative disorders. So, of course, you may have a brief understanding of what these disorders are, but I think a couple of movies have been made. What's that one movie? I forgot the name, where he had multiple personalities. I forgot the name of it, but if you know what I'm talking about, you will know that quite well. So it's along the realms of multiple personalities, but also dissociative. And we'll touch a little bit more on that. So of course, your learning activities is to learn about somatic and dissociative. But I want to jump into some of the key disorders. Some of these disorders you may hear and read about aren't as common and popular as, of course, anxiety disorder, depression, bipolar, schizophrenia, and a few personality disorders and anxiety, of course. But I do want to touch on some of them. So let me see. I'm going to scroll through here. As I mentioned before, I don't want to spend too much time on this. Just to give you guys some. So let's talk about dissociative amnesia. So when we're talking about amnesia, I think everyone knows what amnesia is. Maybe someone that's had a TBI, traumatic brain injury, may experience some form of amnesia, right? So you'll have varying levels of amnesia. Some may only remember short-term memories. Some only may remember long-term memory. So there's different varying levels of amnesia. And with dissociative amnesia, it's similar to having a traumatic brain injury, in that of the loss of memory is not essentially explained by normal forgetfulness, okay? So this isn't just, oh, I forgot where I placed my keys or something like that. It's something more severe and more grandiose than just normal memory loss. So you'll have 3 areas of focus, of course: localized amnesia, selective amnesia, and generalized amnesia. And just like how you have your varying levels of amnesia with your TBI, same with the dissociative amnesia. So localized is more along the lines of being able to recall, a specific event or a specific period of time. And these gaps in memory are usually related to trauma or stress. And we talked about this last week, how much trauma and stress has an impact on our mental health. And the theme is continued with amnesia specifically, and somatic and dissociative disorders. Stress and trauma has a major impact on developing these specific disorders. So for example, for localized amnesia, patients or a client may forget the months or years of being abused specifically as a child, or the days they spent in intense combat, and things like that. So those traumatic events cloud their specific level of memory and things like that. So that's an important factor in how dissociative amnesia works, specifically for specific time periods. So, and the next one is selective amnesia, and it's similar to localized. It's a type of amnesia in which the person suffers loss in certain parts of their memory. So common elements may be forgotten, such as relationships, special talents, specific where you live, abilities in certain areas, or even events and things like that. So that isn't as pervasive as localized because it's, specifically events and things like that. But of course, it's centered around trauma and stress as well. And then lastly, you have generalized amnesia. And this one is quite rare. And it's characterized by a total loss of memories related to one's past and identity. So the person may not remember anything about their life before a certain point, including where they've been, what they've done or said, or even who they were with. So like I said, this one's quite rare, but of course it stems around trauma and stress. And then you have comorbidity. Excuse me. Sometimes that word kind of gives me a little tongue twister. But as I mentioned before, some of these levels of dissociative amnesia aren't as common. So you'll have, they can be in conjunction with conversion disorders. They can be in conjunction with depression, PTSD, and also personality disorder. So those are the specific areas where you would see dissociative amnesia. So moving forward, like I said before, trauma and stress has a major impact, and specifically when they talk about causes and things like that, there's no genetic or biological indicators or links to dissociative amnesia. Like I mentioned before, it's severe stress and trauma, and of course it can be discussed and thought throughout the process of behavioral perspective and psychoanalytic perspective, in terms of the development of it and things like that. And there's quite a bit of things that you can do for treatment. Here's a list of a few of them. But moving forward, dissociative identity disorder. So this is the one I was talking about in terms of, I still can't remember the name. Hold on, I'm going to Google it so I have more information. I'm sorry, I had to Google it because it was going to drive me crazy if I could not come up with the name of the movie. But I did find it. It was Split. And the guy had multiple personalities. But there's a couple other movies that if you want more a reference in terms of what dissociative identity or disorder looks like, there's Sybil, Psycho, The Three Faces of Eve, Frankie and Alice. I've seen that one as well. Me, Myself, and Irene, but also Split as well. And it just gives you an idea of what that may look like in terms of actual progression. So dissociative identity disorder, of course, there's 2 or more distinct personalities, and common causes, of course, are stress and trauma, cross-cultural factors, and lateral genesis. And specifically, if you don't know what lateral genesis is, the official definition is the causation of a disease, a harmful complication, or other ill effect by any medical activity, including diagnosis, intervention, error, or negligence. So that's basically, it's a complication of another illness or disorder, basically. And you'll see this along with PTSD, depression, somatic symptom disorders, substance-related disorders, and things like that. But it's definitely an interesting disorder because it's hard to diagnose sometimes, because oftentimes the psychiatrists think it's bipolar disorder because it's 2 different personalities, or they think it's a personality disorder and things like that, or different mood. So sometimes it definitely is harder to diagnose, but it's not as common as you think it is. As previously, whenever I worked in the mental health hospital, I don't think I saw any clients with dissociative identity disorder, and I saw a lot of clients. So that's just my personal perspective, and it may not be someone else's. But I did see a lot of depression, anxiety, PTSD, bipolar disorder. I saw a few personality disorders, and schizophrenia. I saw that one as well as schizoaffective disorder. But yeah, let's see if there's anything else I want to talk about in this chapter. I don't think so. But as I mentioned before, this chapter is of course dissociative disorders and somatic disorders. And you'll learn more about those whenever you read the chapter. So let's jump into chapter 8, which is honestly one of, not my favorite, I wouldn't say favorite, but the most interesting disorders that you could possibly have, because it's sometimes very hard to treat, let alone diagnose. So let's move on. Let's see. And I think also too, speaking in terms of behavior and abnormal behavior and things like that, personality is definitely one of those things that people look towards in terms of what abnormal personality is and what normal personality is. And there's traditional, I guess, ideas and models of what that should look like. And there's a few areas of, whenever specifically when you go into treatment for therapy and things like that, there's a few personality assessments that are given in terms of just to get a gauge on where a person's personality is. There's a few projective tests and trait tests as well. Some of you may know, like the Rorschach test. It's where you have like the different ink blot figures and things like that. Of course, a lot of theorists and psychologists have discredited the Rorschach test, but I think it's definitely an important part of the history of psychology and things like that. So I definitely think if you don't know what that is, check that out in terms of personality disorder and psychological testing and things like that. So let's talk about the specific classifying of personality disorders. So there's a couple clusters. There's cluster A. There's paranoid, schizoid, and schizotypal. So this is kind of along the lines of the schizophrenia. If you're thinking of schizophrenia, it's kind of similar to that. Not as extreme with the delusions and things like that, but you have your paranoia and things like that. So any odd and eccentric behavior. Then you'll have your cluster B, antisocial, borderline, histrionic, narcissistic. And so many of you should have an idea of what These are, but of course we'll talk a little bit more about them. And these are the more dramatic, emotional, and erratic forms of personality disorders. And then you also have cluster C, which is your avoidance, dependent, obsessive, compulsive, which is your fearful and avoidant and compulsive form of personality disorder. So in this, I want you guys to check this video out because it does give you a crash course on personality disorders, and it's a quite interesting video just to give you a little background. So specifically for cluster A, like I mentioned before, these behaviors are odd or eccentric. So paranoid personality disorder is centered around what the title says, paranoia. So there's a chronic and pervasive level of distress and suspiciousness. So this person may feel like they can't trust anyone, let alone family members, friends, anyone. So they have this chronic paranoia around trusting people. Then you have your schizoid personality. So this one is, of course, a chronic and pervasive social detachment. So they are oftentimes not really, I want to say, interested. So it's specifically characterized by a lack of interest in social or intimate relationships. So they have difficulty with expressing emotions, and they typically prefer a solitary life. So they'd like to be on their own. And then next you have schizotypal personality disorder. And this is followed with the chronic and pervasive social and interpersonal deficits with cognitive distortions. So this typically includes similar to schizoid, being a loner, lacking close friends outside the immediate family. They generally have flat emotions, so they aren't really as animated or things like that. And they're very limited to, specific responses, and a lot of their responses are inappropriate and emotional responses. So these are the type of people that may laugh at the death of someone, things like that. So their emotions and their response is not what you would consider normal. But of course, there's persistent and excessive social anxiety. So they're kind of awkward in public and things like that. So that's just a rundown of the specific genres of the cluster A. Let's see. And of course, with treatments in terms of paranoid, cognitive therapy and antipsychotic medications. So I want to say, when it comes to treatment, whenever I went to my master's program, we talked about treatments and things like that, and how cognitive therapy is very good for specifically behavior and personality. But like I said before, it's kind of hard specifically for schizoid and schizotypal people to seek treatment and to continue that treatment. So it's definitely difficult in terms of treatment for certain personality disorders. Did I skip something? Okay, so we talked about paranoid. Let's talk a little bit about schizoid. So schizoid personality disorder, we've mentioned this before, they're detached from social relationships, and they restrict a range of emotional expressions with others. And like I said before, they're rare to seek treatment. Their social skills are lacking. They don't have any close relationships. They have social deficits and social discomfort, and chronic anxious feelings in social settings. So they typically do not fit in. However, I do want to preface this, just because this person specifically has specific personality traits, say like you may be an introvert, that does not solely make them the schizotypal or schizoid personality disorder. So I just want to preference that. It's a variety of factors of things, and a lot of these personality disorders are clustered on top of other disorders, and it talks about this in the slide, how it's clustered on top of schizophrenia or let me go back, schizophrenia or delusional disorder or things like that. It's on top of other things. So I just want to preface that so you're not thinking, oh, I'm a little introverted. Am I schizophrenia or schizotypal or schizoid personality disorder? No, that is not what that means. So I just want to preface that before. Okay, so of course, personality disorder in cluster B. So that's dramatic, emotional, erratic. So just to name a couple of things specifically with antisocial disorder, and that's similarly in terms of what the name really prefaces is there is a kind of psychopathic tendency to it, and we think about how multiple serial killers and things like that have these tendencies. So antisocial disorder or personality disorder is, characterized as an antisocial person in terms of their psychopathic tendencies, and a lot of times it begins at a young age with specific behaviors and things like that. And the DSM goes into quite detail about specifics in terms of antisocial disorder. Of course, you have this picture, like I said before, with specific serial killers and things like that. So with this personality disorder, there's specific characteristics, of course, is they don't have a conscience. They're very impulsive. They lack any emotional ties, and they lack the ability to make a good impression. So let's jump right into borderline personality disorders. This one may be a little more common. I find that this has been more widely diagnosed more recently. So it's characterized, of course, by unstable relationships and emotions with dramatic shifts. So this person doesn't really maintain personal relationships very well. There is this disorder is predominantly more in females than it is in males. So that's a little bit of where the gender bias comes in. But it definitely is, it impacts the way you think and feel about yourself and others. So it causes problems with functioning in everyday life. So your self-image, your, of course, difficulty managing emotions, your behavior, and just a chronic pattern of getting into unstable relationships and getting out. And it's just a cycle of, relationships and emotions and things like that. So, histrionic. So this is definitely one of the interesting ones as well. Histrionic is one of the personality disorders that is exclusively looking for attention, kind of like attention-seeking behavior, and they're kind of dramatic and theatrical. And I also know that with bipolar disorder, there is kind of sort of a histrionic caveat to that disorder. So the people with this disorder have, an overwhelming desire to be noticed and often behave dramatically or inappropriately to get attention. And they also tell like grandiose stories, and they're just very animated, and hence the story histrionic. So yeah, I think that's all I want to talk about that. Like I said before, you guys will read more and more about this. I just wanted to do a brief overview of what each one means. And if you have any questions, you can always email me with more specific details. And then you have your narcissist personality disorder. So this person, of course, is self-centered. They require others' admiration, things like that. And that one is specifically within the name. I believe at this point everyone should know what a narcissist is, and the symptoms and what they look like. And so you'll get a gist or idea of what that personality disorder looks like. And then you have cluster C. So that's, of course, avoidant or fearful. Avoidant personality disorder, dependent personality, and obsessive. I'm trying to see if there's anything else I want to talk about with this. I always say I'm not going to talk too much, but then I always go overboard. I'm sorry. So obsessive compulsive personality disorder, and it's similar to OCD, but it's with the personality component. So it's your preoccupation with control, orderliness, and perfection in terms of how people view you. Let's see. And that's it. That's all I pretty much want to talk to you about. Like I said, I wanted to just touch on a few areas of focus. If you have any other questions, comments, concerns, please feel free to reach out to me. You have a fairly short week of activities this week, so it should give you guys a little bit of a break. I do want to jump in and see what you guys have for next week in terms of assignment wise. Just to give you guys a heads up, like I said, this week is kind of a breather week, and you do have an essay that will be due at the end of week 5. So let me pull up my calendar. So at the end of week 5, so that won't be until August 2nd, I believe. Yes. So just to give you guys a heads up on that, it is another paper, so you are prepared. And if you want to jumpstart and get a head start on that, you can do that. But I just wanted to jump on here and, give you guys a brief overview. I hope you all have a great week, and I look forward to grading your papers. Until next time.